All right, guys, welcome into Chapter 5. Today we're going to be talking about adult and child CPR. These two forms of CPR are the most similar. There's only a couple small differences between adults and children, and we'll talk about those a little bit, but that's why these are grouped together. This is the material that you'll use for the adult and child CPR exam that is part of week 3 in our modules, and also part of Chapter 5. So let's get started. Okay, so the first thing you have to understand when we're talking about CPR is CPR is used to treat cardiac arrest. It's not used to treat a heart attack. So a heart attack is when heart tissue dies because the blood supply to that heart tissue is either cut off or it's stopped. Okay, heart attack will eventually lead to cardiac arrest, but it's not the same thing. Cardiac arrest happens when the heart stops beating, and this can be for several different reasons. It could be because of a heart attack that eventually all the heart tissue died in, so the heart stopped beating, or it could be as a result of an arrhythmia issue, some sort of an electrical impulse that didn't occur, an injury, an illness, lots of different things. Okay. In caring for cardiac arrest, there are 6 things that must be done to create the best chance for survival. Okay, first and foremost, cardiac arrest needs to be recognized, and then EMS needs to be activated. Okay, shortly thereafter, doing high quality CPR as soon as possible, rapid defibrillation. Then comes in the basic and advanced EMS, so emergency medical services arrive and the ambulance arrives. The post cardiac arrest care that's done in the hospital, and then recovery that can be done through physical therapy and those sorts of things. All right, CPR stands for cardiopulmonary resuscitation. Okay, CPR is performing chest compressions that circulate blood to the heart and to the brain until a defibrillator and emergency medical services will arrive, EMS. Now, I would also add part of CPR is giving breaths, which provides the oxygen to your lungs that then gets put into the blood so that when it's circulated through the body, you're able to circulate oxygen to your body tissues. CPR is really a Band-Aid. Okay, CPR does not restart the heart, with very few exceptions. There are some rarities where that does happen. But for the most part, CPR is just being done to keep the person alive and keep the person's body and body tissues from dying until EMS arrives, or we can use a defibrillator, an AED, to shock the person's heart and restart the heart's rhythm. That is what restarts the heart. CPR does not really restart the heart. Now, the AED and those things we're going to cover next week as part of our infant CPR and AED chapter. That's part of our infant CPR exam. So it's not on the adult and child CPR exam, but that is something you do need to just have a light understanding of for this material. All right, so this part is really above our pay grade and happens after us. But after we've done the CPR and we've done used the AED, done the best care that we can provide, then comes in advanced care provided by the paramedics, post-arrest care, which happens at the hospital, and eventually recovery, treatment, and things like physical therapy to help the cardiac arrest survivors. All right, so adult and child CPR, these are CPR techniques that are similar for infants, children, and adults. There's just some slight variations. So first and foremost, you have to understand what constitutes these different age breaks and when we do CPR on these different people. So on adults, adult is somebody who has gone through puberty or older, some like teenagers and above, okay? Children is anywhere from 1 year to the age of puberty, and infants are younger than 1 year. Now, when you come upon an emergency, you're not going to the person is probably going to be unconscious, and it's not like you're going to be able to ask them, right? Like, how old is this person? You probably don't know. So from there, it goes more based on size. Okay, and we'll talk about that when we get into actual CPR. So the way to remember the CPR sequence, we use an acronym called RABCAP. Okay, this will become very important, and this will help you a lot through the exam and through the practical. So make sure you understand what it stands for. Okay, so the R in RABCAP stands for responsiveness. So when checking for responsiveness, that's the first thing you do. When you come upon somebody that appears to be unconscious on the ground, you're going to check responsiveness. You're going to come up to them, you're going to tap their shoulder and ask if he or she is okay. Now, that doesn't mean you hit them really, really hard. You're not going to move the person per se. You're just going to do a forceful but not push them over, not enough to move them, tap, and say, are you okay? Are you okay? Okay. If the person does not respond, they are said to be unresponsive, for the purposes of CPR. Okay. All right. Now, in an adult, when it is determined that the person is unresponsive, you immediately call 911 or you ask a bystander to call 911. Okay? 911, excuse me. If you have a mobile phone, you can call, put it on speaker, and then continue CPR. If a mobile phone isn't available, you can, and you're by yourself, you leave the person, call 911, grab an AED, and come back. The reason being that we know in an adult, the most likely cause of cardiac arrest needs to be mediated by an AED or by emergency medical services, EMS. So CPR by itself is unlikely to fix the cause of the problem. It's more like a Band-Aid, like I mentioned earlier. Okay. Now, for children and infants, this is different. And we're going to talk a little bit about this when we talk about infants as well. But with a child or an infant, because the most common cause of cardiac arrest in infants and children is an uncorrected respiratory issue, right? Which means they're most likely choking on something. So if we are able to do CPR and get the object that is lodged in their throat out, that is what is most likely to save them. So we want to get on that right away. The AED and EMS, okay, are needed, but the CPR is what's most likely going to dislodge that object. Okay, does that make sense? If you have questions, feel free to reach out. Okay. All right. So after we've activated EMS, so to recap for activate, okay, on an adult, once you determine they're unresponsive, you call 911. On an infant, you go straight into checking for breaths once you determine that they are unresponsive in a child or an infant. Okay. When you check for breathing, you check breathing for 5 to 10 seconds. No more, no less. Okay? Less than 5 seconds, you may miss a breath because there can be up to 5 seconds between breaths. If you go longer than 10 seconds, then you're just wasting time. Okay? To check for breathing, this is what you do. You put your ear down by the person's mouth and you look down their chest. You watch for their chest to rise. Okay, you listen for breath sounds and you see if you can feel the air coming out of the person's mouth or their nose onto your face. Okay, look, listen, and feel. If you do not see breath sounds, that's when we move on. Okay. If it is determined they're unresponsive and they are not breathing, this is when we move into actual CPR. So we start our chest compressions. So we've done the RAB, now we're on the CAP. Okay. For an adult, well, and in general, when you're doing CPR, you want to put the patient on a firm, flat surface when it's possible. If it's not possible, it's not possible. You just do what you can. Okay. You have to bare the chest. That means you have to take off their shirt. In women, that means you also have to cut their bra. You have to bare the chest to be able to, one, get the AED pads placed when they arrive. But as far as compressions go, to do high quality CPR, you want nothing between your hands and the person's skin. Because if there's a zipper, if there's a button, if there's a seam underneath your hands, that can actually start to hurt your hands while you're doing CPR, and it can lessen the quality of your CPR. Okay? For an adult, you're going to use two hands. You're not going to cross your hands. You're going to lace your top hand's fingers into your other hand. And I'll show you this on the next slide. Okay? And you're going to perform your compressions. You need the depth to be 2 to 2.4 inches as far as you're pushing in. To kind of put a caveat to this, you're going to push hard. Okay? It's not a light push. You're going to push pretty hard, and you're almost going to feel like you're hitting the bottom, pushing as hard as you can. Okay? It's not a light thing. It's a very strong movement. Okay? Also, it's not uncommon to feel ribs break or feel like pops and cracks and stuff. That's ribs that can be, the cartilage can be breaking and those types of things. That is normal. Now, depending on who you talk to, when you talk to like EMS providers and stuff, some will say like, oh yeah, I feel ribs break every time. And some will say, I've never felt that. It just depends. But it is a possibility, and it's normal. Okay, we're worried about saving the person's life. We can deal with that type of stuff later. All right. Now, for a child, the only difference on a child is you're gonna, if the child is small and you really feel like it's too easy, you're gonna go down to one hand. Okay. And for a child, you're going to compress about 2 inches. That's really important. All this stuff is really important. But make sure you're familiar with it all. But some of these numbers, like 2 to 2.4 inches, getting at least 2 inches of depth on an adult. Whereas for a child, 2 inches is kind of the max, what we're looking for. Okay? As far as depression of the chest. Okay? More on chest compressions. You want to put your hands in the center of the chest. Okay? So you feel for the sternum, which is the hard bone right in the middle of your chest between the breasts. Okay? And you want to be middle, somewhat lower half. You don't want to go too far. If you go too far down on the sternum, you'll push on their xiphoid process, which is a little hard notch at the end of your sternum. That can be dangerous. That can be, if you break that, that can get sharp and that can puncture things. So you don't want to go too far down on the sternum. You want to be sort of the center of the sternum. Okay. Now, the reason we don't say between the nipples, right, in adults is because in adults, nipples can be in different places, right? Males, their nipples may be up here, but females who have breasts, their nipples may be down here. That's just a normal anatomical thing. So that's why we don't say nipple line. You want to go on the center of the chest over the middle to lower half of the sternum, okay? The compressions you're going to give are at a rate of 100 to 120 compressions per minute. That is the same for everybody, including infants. And the hand placement is the same for adults and children, okay? Infants is just a little bit different, okay? And you're going to give 30 compressions per cycle. So you give 30 compressions, okay? And then we're going to move to breaths, which we'll talk about next. Okay, don't worry, I know this is a lot right now, but we are going to do kind of a sum up at the end so you can see it all put together, okay? All right, now that we've given 30 compressions, we're going to move on to giving 2 breaths, okay? Now, as part of the 2 breaths, we have to open up the airway. That's what the A stands for in CAP, okay? Airway open. To open the airway, we use what's called the head tilt chin lift maneuver. This figure below kind of shows you how to do it. So you put, when the person's head can be like slumped forward, it can cut off their airway with their tongue, okay? So to open the airway, what we do is we push down on their forehead and lift with their chin, okay? and you're going to want, their head's going to be a little above neutral, right? Like this looks somewhat neutral, straight. It's a little above neutral to open up that airway, okay? Now, the way to check for whether your breaths are getting in is whether their chest rises or not, okay? If their chest doesn't rise, the breaths are not getting in, which we'll talk more about that when we get to breaths on these next couple slides, okay? So you have to open the airway with the head tilt, chin lifted over, okay? Now you keep the person's airway open while you're giving the breaths. You don't just lift it and then let go. You have to hold on still. Okay. Now, in adults, to prevent the air from escaping when you give breaths, you have to pinch the person's nose shut. Okay. If you have access to a mouth to barrier device to prevent any sort of disease transmission, those sorts of things, use that. Okay, you're going to place it over their mouth. Then you're going to give 2 breaths, each lasting 1 second. You're going to watch for the chest to rise and fall as you're giving the breaths. So, when you give your breaths, it is somewhat forceful. Okay, you're not just going to, when you give breaths, you're going to actually blow somewhat hard. Okay, in an adult, you're probably not going to pop their lungs, right? Your lung capacity is about the same as theirs. So the chance of you rupturing a lung by blowing too hard is pretty low. So blow hard, make sure that that chest rises, okay? If the chest does not rise, all right, then you can try up to 4 times to get the breaths in before you move on to your next cycle of compressions and breaths. So a cycle of CPR is compressions and breaths, okay? So once you've done your breaths, you go back to compressions and you just keep going until EMS arrives, right? Or until the AED arrives, which we'll talk about in a little bit. But if those first 2 breaths do not go in, okay, you can try again up to 4 times total before you go back to compressions. At that point, if the breaths just aren't getting in, just move on and go back to compressions. But those breaths are important, okay? So just because a breath doesn't go in doesn't mean you just move on. You keep trying up to 4 times. So you only need to get 2 compressions per cycle. So once you've gotten 2 breaths to go in and their chest to rise, then just move on. Okay? Anyway, if you have questions about that, again, we're going to watch this video, but feel free to ask. Okay? So you're going to keep doing CPR. So once you've got into it and you're doing your compressions, you're doing your breaths, you're going to keep doing your compressions and breaths until the person begins breathing, an AED arrives, EMS personnel arrive and take over, the scene becomes unsafe for some reason, or you become too tired to continue. This is really important. This is on your exam. This is going to be on the final, all those things. So make sure you understand this, okay? These are the only 5 reasons why you would ever stop CPR. If you stop without one of these 5 things occurring, you could be guilty of, if you'll remember, abandonment. So, if the person starts breathing, you can start CPR. If the AED arrives, then we have to get the AED set up. If EMS arrives, then they can take over and take care of it. If the scene becomes unsafe, then you may be at risk, and that's not helpful to the person. Or if you become too physically exhausted to continue CPR, then you can stop. Okay? All right, so I talked a little bit about mouth barrier devices for CPR. There's a few different types that we're going to talk about. First and foremost, if you can do mouth-to-mouth breathing. Now, I know it seems kind of gross, but me as an athletic trainer, as a provider, I have decided that if I don't have a mouth-to-barrier device, I'm just going to do it. I can deal with, the awkwardness of me kissing the person later, all right? But I want to save this person's life. Some other barrier devices that are available. You have pocket masks. So one of these, I have one of these in my bag. This is most likely what I would use. Basically, you seal it. This goes towards their nose. So you put it towards their nose and you seal it with your fingers. and then you blow through this and it blows it into their airway. Okay. You do also have face shields. That's what these are. This goes over the person's mouth. And when you breathe, the air goes through that directly into their mouth. Okay. You can perform what's called compression only CPR. That is not recommended. Okay. If you have decided that you just can't physically do mouth to mouth without a barrier device, you'd pass out if you do it, then compression only CPR, would be appropriate. But it's just not that helpful. Okay. I mean, the whole point of CPR is to keep your body tissues alive with oxygen. If they're not getting oxygen through your blood because you're not giving breaths, that kind of defeats the purpose. Okay. So, when you're doing your breaths, you want to position yourself by the person's side. Again, you're going to pinch those nostrils with your thumb and your index finger. Open the airway with the head tilt chin lift maneuver. Then you're going to place your mouth over the person's mouth and gently breathe into the person's mouth for 1 second. I don't love that word gently. I may change that later. You're going to somewhat forcefully breathe into the person's mouth, and their chest will rise if you do it correctly. Then you take your mouth off, take a breath for yourself, and then give another breath. Okay, your breath will only last 1 second. Okay, and that's why you take that breath for yourself in between. Mouth to mask, really the only consideration is for these other breathing devices. If you have a mask, make sure the top point goes towards on an adult, goes towards the person's nose. Okay, and make sure you still are going to perform the head tilt chin lift maneuver, but you have to seal the mask with your fingers, right? Make sure it's pressed firmly against their face in order to prevent air from escaping from underneath the mask. Mouth to face shield is pretty much the same. We're still talking about masks. I already talked about that. As far as face shields go, it's the same. The only difference is the face shield can become kind of annoying. It can fall off of their face while you're doing compressions and those types of things. If it falls off the person's face while you're doing compressions, don't worry about it. Okay? Fix it when you go to do breaths. All right? Now, they're like one size fits all, so it's probably going to cover their whole face, and that's fine. Right? As long as whatever filter or whatever the face shield has that goes over their mouth, make sure that it's over their mouth and that you pinch their nose. You still have to pinch their nose even if you're using a shield, because air can still escape through their nose whether you have that face shield on there or not. Okay. Again, this just kind of says the same thing. But yeah, the procedure is pretty much the same with just those few little nuanced differences with masks and face shields. All right, now we're going to watch a short video that kind of puts it all together. Okay, I know that was a lot of material, but this is how you should perform CPR.
Skill, adult and child CPR and AED use. When breathing has stopped, the heart will too. CPR and an AED can help save a life. For CPR, use a mouth-to-barrier device to prevent disease transmission whenever possible. Use the RABCAB mnemonic to remember what to do for CPR. R stands for responsive. Tap the person's shoulder and shout, "Are you okay?" A stands for activate EMS and get an AED. Shout for nearby help. If someone responds, have them call 911 and get an AED while you start CPR. If you are alone and the person is an adult, call 911 and put the phone on speaker mode so that you can prepare to follow the dispatcher's instructions. If a phone is not available, leave the person to locate a phone and get an AED. If you are alone and the person is a child, give 5 sets of 30 chest compressions and 2 breaths before calling 911. B stands for breathing. Place the person on a firm, flat surface. Take 5 to 10 seconds to observe the person from the neck to waist for movement, rise and fall. If the person is not breathing or only gasping, continue to the next step. C stands for compressions. Move enough clothing away from the chest. Place the heel of one hand in the center of the person's chest on the lower half of the breastbone. Place the heel of the other hand on top of the first. Interlock the fingers of both hands to keep your fingers off the person's ribs. The heel of your hand should be the main point of pressure on the chest. A child, use one hand. However, depending upon the child's size and your size, 2 hands may be necessary. Position yourself directly above the person's chest so that your arms are directly above your hands. With your arms straight and elbows locked, push hard and straight down on the breastbone at least 2 inches on the person's breastbone with the heels of your hands. Allow the chest to fully recoil after each compression. Do not lean, rock, bounce, or jab on the chest. Do not stop at the top or bottom of a compression. When performing CPR, deliver 30 compressions at a rate of 100 to 120 per minute. It may be easier to push to the beat of the Bee Gees song, Stayin' Alive, which is 100 beats per minute, or to the beat from a CPR smartphone app. A stands for airway. Open the person's airway using the head tilt chin lift maneuver. B stands for breaths. Pinch the person's nose shut and make a tight seal with your mouth on the mouth-to-barrier device or the person's mouth. Give 2 breaths, each lasting for 1 second. Do not blow too forcefully or for too long. Take a normal breath for yourself after each breath. Watch for chest rise to determine if your breaths go in. Allow for chest deflation after each breath. When an AED becomes available, use it as soon as possible. Turn on the AED.
All right, we're going to stop there because we don't really talk about AED until next chapter. A couple of things I wanted to mention that are important. Okay. When it talks about hand placement, it talks about putting most of the force into the heel of your hand, and that is true. Okay. You do not want to rest your fingers on the person's chest. For one, that's kind of creepy. And number 2, if you do that, your pressure does not go directly in the center of the person's chest. It can kind of actually come out here, and it messes with your CPR, and it's not quite as high quality. Okay. Number 2, when it says like 100 to 120 breaths per minute, you can use the Bee Gees song, right? Like most of you have probably seen that episode of The Office where they talk about that. Now, that's true, but it's faster than you think, okay? It's not like sprinting, but it's a good steady 1 and 2 and 3 and 4 and 5 and 6 and 7. It's fairly fast, okay? The other thing you can do that will help you, okay? Count out loud. When you count 1 and 2 and 3 and 4 and 5, then you keep track of where you're at. You do the right number of compressions. That is important. Research has shown 30 compressions, 2 breaths is the most high quality form of CPR and is the most effective. Okay? Now, any of these other questions, make sure that you reach out to me and ask. This is very, very important that you understand how to do this. And we're going to have the practical, and that will help some. But I want you guys to figure out how to do this and make sure you know how to do it. Okay? All right. I talked a little bit earlier about compressions only CPR. I do not recommend this. Okay? It's not really going to be that helpful. Again, if you choose to do it, you follow pretty much the same protocol just without giving the breaths. Okay? Again, I don't think it's really that helpful. For a momentary need, it may be helpful to continue to circulate some of the blood, but that oxygen only lasts so long. Okay. The other thing you have to be aware of is whenever you perform CPR, there is always a chance of contracting some sort of disease, okay, some sort of airborne pathogen, something like that. Very few of those are life-threatening. If you do have access to a face shield or a face barrier, that is the most helpful. If you don't, you know what? It's totally up to you, but I would suggest you just continue with the CPR regardless. All right, now that we've talked about CPR and what to do for somebody who is unresponsive and not breathing, let's talk about what to do if they're breathing. Okay, if somebody's unresponsive and still breathing, you want to place them on their side in the recovery position. Okay, the recovery position has many advantages. For one, it helps keep their airway open so that they continue to breathe. If they have any sort of fluids in their nose and their mouth, it drains the fluids out of those. And once they're in the recovery position, you should be confident enough to leave and call 911. Okay, now to place the person in the recovery position, you need to do a couple of things. You want to roll them onto their left side. Their bottom arm, so the arm that's closest to the ground, you want to extend outward, kind of like that picture from the last slide. The top arm, you want to rest on the bicep of the bottom arm. Put their hand on the bicep of their bottom arm, their upper arm of their bottom arm. Okay. The top hand, you can put under the person's cheek. So forget what I said before. You want to rest their arm on their bicep, but you put their hand underneath their cheek, kind of cushion their cheek and their face. On their top leg, you want to bend their knee and their hip, okay, and have it kind of in a bent position. This helps keep them from rolling back onto their back. And their head, you want to extend their chin so that their airway is still open, okay? All right, now, if somebody has some sort of an airway obstruction, these are some things we want to look for. So now we talked about CPR. Now we're going to talk about choking. This is kind of the last little part of this chapter, but this is also on the exam, so make sure you understand this stuff. So if there is a mild obstruction in somebody's airway, they're still going to have some air exchange. They're still going to be able to get oxygen in and breathe carbon dioxide out, but it's going to be a little bit harder. They're probably going to have forceful coughing. So they're going to be coughing, trying to get whatever it is out. That's the normal's body reaction to choking, okay? If they are coughing, you want to encourage them to continue to cough so that they can get the object out, okay? If somebody is coughing and they're choking on something, you do not want to hit their back. This sort of force may actually cause the object to move back down, okay? The coughing is enough to help get that object out. Now, if there's a severe obstruction, okay, this is going to cause breathing difficulty and maybe even no breathing at all. They may not be getting any oxygen, okay? They may be coughing, but it'll probably be weak and ineffective. They're likely going to be unable to speak or breathe, and they may even start to turn blue, okay? One of the most universal signs of choking is if somebody brings their hands to their neck, because it's just a very natural reaction to choking. Okay, so look for that as well. There are a couple of different recommendations depending on the organization that you look at. So the American Heart Association recommends abdominal thrusts or the Heimlich maneuver, whereas the International Liaison Committee on Resuscitation recommends back blows and thrusts. We're going to talk about both of them. You can use them as you see fit, but traditionally, abdominal thrust is the most common form of caring for an airway obstruction. Okay. So, the Heimlich maneuver, how to perform the Heimlich maneuver is you do this. You get behind the person, okay? You reach around the person's waist with both arms and you find the belly button. Once you've found the belly button, you place a fist, either hand, it's kind of up to you, with the thumbs towards the person's abdomen right above their belly button, okay? You want that fist to be above the belly button, but below their rib cage. Okay. Then you're going to grasp that fist with the other hand. When you perform the thrust, you're going to press into the abdomen, so pull towards you, in and up in a fast motion. Okay, it's not a soft thing, it's a pretty quick thing. You're going to continue to perform those thrusts until the object comes out or until the person becomes unresponsive. Okay, if the person becomes unresponsive, then we move to CPR because now they're unresponsive and they're not breathing. Okay, now we're just going to watch a quick video kind of putting it all together.
Skill, responsive adult or child choking, abdominal thrusts. Signs of choking are when an adult or child cannot speak, breathe, or cough and may be clutching the throat. Clutching the throat is the universal distress signal for choking. Ask the person, "Are you choking?" Shout for help to alert others of the emergency. Give abdominal thrusts. Standing behind an adult or standing or kneeling behind a child, wrap your arms around the person's waist. Locate the person's navel with a finger. Usually right-handed people will use the left hand. Make a fist with the other hand. Right-handed people will usually use the right hand. And place the thumb side just above the person's navel and below the tip of the breastbone. Grasp the fist with your other hand. Thrust the fist into the person's abdomen with a quick upward motion. Each thrust should be a separate and distinct effort to dislodge the object. Use chest thrusts on a choking, very large person or pregnant woman. Continue without interruption until the person coughs up the object, speaks, or breathes, or until EMS or a trained person takes over. If the person becomes unresponsive, give 30 compressions and 2 breaths. Before each first breath, look into the mouth for an object. If an object is seen, remove it. If the person is found unresponsive, perform all the CPR steps of RAB-CAB. When giving breaths, if the first breath does not cause the chest to rise, retilt the head and give a second breath. If the second breath does not make the chest rise, begin CPR by giving 30 compressions followed by 2 breaths. Each time before giving a first breath, open the person's mouth and look for an object. If an object is seen, remove it. Continue sets of 30 chest compressions and 2 breaths until an AED becomes available.
All right. So again, some training organizations do not teach the back blow technique, only abdominal thrust, but both can be effective. Essentially, to do back blows, the person has to be bent over at 90 degrees, and then you hit the back of their chest with your hand between their shoulder blades 5 times. Okay, then you go back to the Heimlich, and after you've done 5 abdominal thrusts, then you go back to back blows. Now again, I don't love this for adults, mainly because, I mean, only doing 5 seems like kind of counterproductive because if one is working, it may require more than 5, right, to get that to work. A couple other special considerations you may think of if you are doing chest compressions on a pregnant woman, you don't want to pull up on their abdomen, okay? You may need to lay them down and deliver chest compressions as opposed to abdominal thrusts, okay? That is all for our adult and child CPR chapter. Now, I know there's a lot here, but go ahead and watch the videos that are in the week 3 module if you need to review this lecture as much as you need to. Yeah, if you have any questions, feel free to reach out. Send me a message, send me a call, send me an email, or give me a call, send me an email, whatever works best for you. And I'll try to help clarify some of these concerns.
This is the access code for the exam. It's typed in
just like this, as it's shown. Capital T, capital W, and their spaces.